Hi there. So I'm going to talk a little bit about rejuvenating the upper eyelid area. So I stress the point area because a lot of times people, when they look at themselves and they have heaviness and hooding in their upper lid area, they assume that it's just the upper eyelid skin that's involved, which it is in almost every case. But there's also other components that are involved, and really, it's extremely important to understand what the actual goal is, right? So if you're seeing heaviness in this area, it's important to dissect what are the components that are causing the heaviness. Like I said, in majority of cases, almost 100% of the cases, it is a result of excessive upper eyelid skin. But directly on the outside of the upper eyelid, just beyond that area, there's a contribution of the outer brow. And what happens there is that normal part of aging and just all around sort of changes that happen to that region is that the temple starts to slide down a little bit. And when the temple slides down, the brow comes down with it, and what you start to see is there's a hooding way out to the side here. And that hooding is often mistaken as the upper eyelid. So, and believe it or not, that is also mistaken by some surgeons as well as the patient's own interpretation. So what happens is in those situations is an upper eyelid blepharoplasty is performed, which really should be taking out skin just to the outside part of the eye, just about right there. And then what ends up happening is after the procedure, patients will notice that, you know, what's happening here? I still have a bunch of skin on the outer part of my eye. Hey doc, did you not take enough out of my upper eyelid? The answer is no, the upper eyelid procedure was enough skin was taken out, but this is the contribution from the brow that's coming out. So a really sophisticated approach is to properly diagnose what's going on in that area. And what happens is if this aspect is involved, well, guess what? You need to have that area lifted at the same time, because otherwise you're going to have an unsatisfactory outcome and you're not going to be pleased with what you see. Because I'll tell you, if you end up removing this extra skin all the way out to the outer portion of the crease, what you're effectively doing is you're pulling the brow even further down, which then makes it more complicated in the future. If you try to bring the brow back up into position, you're pulling the eyelid up with it. So it creates a messy, overall outcome, which is not exactly, what you would say a very high-level approach to the upper eyelid complex. So what I do in every single case is look at both of those areas in entirety. I lift this area up a little bit, see if that releases the hooding in this region, and if it does, then we know that the lateral brow is involved and you need a lateral brow lift, and I'll discuss that in a moment. If not, then we just do a straight upper blepharoplasty. So it depends on the circumstances. Every case is different. And in the cases of an upper blepharoplasty, the way we address it is basically, the way I address it is an incision is made in the natural eyelid crease. I never try to use measurements of where I want to put the incision. The eyelid crease is the eyelid crease. That's where the skin folds on itself. So we always want to put the incision there. If the incision is put there, the eyes never lose shape, never create a new look, and always hide the scar very, very well. And then once the incision is placed in that area there, the excess of skin that you don't need for closure of the eye is removed. And that's the only target. I don't take out fat from the upper lid unless somebody has a significant amount right in the corner there where some people have, but I never take it out from the central eyelid, and I never take out muscle because we need that muscle to be able to function and close our eye properly. And if I take out too much skin, you end up creating a problem where you can't close your eyes all the way. So technique is paramount, as well as proper incision design, as well as proper diagnosis and surgical planning to come up with the right balance and combination of procedures to give you a refreshed all-around look to that area without changing your natural look. Now, specifically with the lateral brow lift, a lot of people think of the brow lift as when they hear the term brow lift, they think surprise look or unnatural or new look. That is absolutely true. Typical brow lifts will create that type of an effect. They'll kind of lift your brow into positions they never have been in before, and that creates a look that is new to you and oftentimes kind of unattractive and actually even more aged look. So what we do with what I do with the lateral brow lift, this is something that I've evolved to developing over the years, but I make a small incision inside the hairline up in here, and basically from there I lift the fascia off the skin and then bring that area up, so it just elevates the loose tissue that's underneath the skin. never dismantling the muscles around the brow or any of those things. So as a result, we always end up having a naturally placed lateral brow and a very subtle look, which, like I said before, is really targeting this corner here and trying to elevate that into proper position. So it's not a scary idea. It's not something that has a lot of potential to turn one way or another. It always gives us a dependable restoration of that corner of the brow, lifts up that hooding around the outside part of the eyelid, and leaves the eyes looking more refreshed. So again, in combination, those two procedures work beautifully. And as I mentioned during the fat transfer segment, sometimes when you have a very hollow looking eye as well, fat transfer is the third component to restore some of the fullness out along the upper eyelid and brow to create a really very, very healthy and youthful shape to that eyelid. But that's something that is done in a case-by-case basis. But the main surgical components are the lateral brow and the upper blepharoplasty. Both procedures can be performed under IV sedation with local anesthesia, and once they're combined, they have a very nice all-around outcome, and like I said, we can split them up if necessary. Thank you.